Hello, participants. Welcome to the N4G Summit Side event on tools for monitoring diet quality across countries. My name is Diana Carter. I'm a nutrition officer at FAO headquarters in Rome, Italy, and I'm honored to moderate this event. Please feel free to use the chat to introduce yourself. And please note that there's interpretation services that are available. There's a little globe at the bottom, and please select the language you need. If you have a question for the panel, please place this in the chat. And if it's for a specific panelist, please write first the name of the speaker to facilitate responses. I'd like to now move to our opening remarks. We're going to start with Roswitha Amels, who's a senior policy officer in the Food and Nutrition Security, the Global Food Policy and Fisheries Division, in the Federal Ministry for Economic Cooperation and Development in Germany. Please, Roswitha, the floor is yours.
Yeah, thank you very much, and good afternoon from Germany. Colleagues from EU, from the organizing organizations of this event, namely FAO, USAID, Rockefeller Foundations, representatives from various countries, national and international organizations, research institutions, distinguished guests, ladies and gentlemen. Thank you very much for the organization of this event alongside the N4G Summit. I'm very pleased to give these opening remarks on behalf of the German Ministry for Economic Cooperation and Development, and at this launch of this new tool for monitoring diet quality. We all know hunger's on the rise. More than 800 million people worldwide are undernourished. Climate change, conflict, and the economic impact of COVID-19 have put the world off track to ending world hunger and malnutrition in all its form by 2030. Germany is highly committed to the implementation of the 2030 Agenda for Sustainable Development. And we remain committed to fighting hunger, which is stated in the coalition contract of our new government. Robust indicators and data are essential to measure progress. Still, diet quality is not reflected in any of the SDG indicators. So I'm very pleased Germany, together with the EU and FAO, supported the development and testing of the indicator Minimum Dietary Diversity Score for Women, the MDD-W. This indicator proves to be relevant for management and programming of nutrition-related interventions. Therefore, we welcome the idea to include this indicator as indicator to the SDGs in the future. We appreciate that the MDD-W should advance to capture not only to measure global dietary perspectives of women, but also of the entire society and beyond malnutrition. The newly developed questionnaire tool allows data collection for an advanced dietary quality indicator, which is extremely important. Under the Innovation Fund of the EU and BMZ to co-finance the program Capacity for Nutrition, C4N of GRZ, one of our implementing organizations, we support this global diet quality project and the development of the dietary quality questionnaire, the DQQ tool. With €1 million, we supported the testing and development of this questionnaire. And I must congratulate to the Wageningen University and thanks to cooperations with Harvard University and other partners for developing this tool. And this will hopefully also be integrated in a post-SDG framework. And I wish you all the very best for further developments and like to thank everyone for putting the efforts into this work, and thank you very much for joining today's event. Thank you very much.
Thank you, Roswitha. I'd like to turn to Leonard Mitzi, who is the head of unit for F3 Agri-Food Systems and Fisheries and the Director General for International Partnerships of the European Commission. Please, Leonard, the floor is yours.
Thank you very much, and Thanks to FAO, thanks to BMZ and all colleagues. I see over 200 participants. This really comes a few hours after a momentous historic Nutrition4Growth Summit, where also the topic of healthy diets was discussed. And it comes a few months after the UN Food System Summit. So for us, this collaboration, this initiative around data and global diet quality data is important to embed what we have been discussing in the past 2 days at the Nutrition4Growth Summit in terms of what is the typology of data that is required. There is still a lot of discussion in our specialized community about data, quality data, nutrition and gender, being sensitive also to gender sensitive data, and how a qualitative dimension to a good quality data in terms of diets can actually help in terms of national pathways in the countries of intervention. In our programming, we have around 55 countries which have identified nutrition and food systems, but not only food systems in a stricto sensu sense. It's also education, health, human development, and also the cross-cutting dimension of biodiversity, food, and climate. How can we use this data in terms of giving policy advice in our sectorial dialogues that we will have with the interested partner countries, with their own-based agencies and beyond, in terms of nudging a policy framework which helps us into more healthy diets. This was one of the panels of yesterday. And the healthy diet is very specific. One speaks, I come from the Mediterranean, one speaks about the Mediterranean diet as being the best diet, but not everyone can have the Mediterranean diet in the regional context in parts of Africa or Asia or the Pacific. So what would make a healthy diet, a qualitative diet in terms of the availability of foods, typology of foods which are diverse, which are accessible, also in the context of COVID recovery, green recovery. So what I would like to hear from participants in this our long discussion is what would make data useful from a policy framework in an intersectorial way across different ministries, ministries of education, ministries of science and technology, health, food, agriculture, livestock, aquatic. So this would be useful for us because this will help us also in our baselines of discussions at the highest political level, policy dialogue in Rome with the Rome-based agencies and with the partner countries. Over to you and looking forward for the proceedings.
Thank you so much, Leonard and Rosita, for your opening remarks. We now move to Anna Herforth, who is the Senior Research Associate in the Department of Global Health and Population at Harvard T.H. Chan School of Public Health, and as well visiting senior researcher at Van Wegen University in Research. Anna will provide us with a presentation of the country-adapted dietary quality questionnaires. Thank you, Anna, and over to you.
Thank you very much, Diana, and to all of the panelists who are joining today and all of the participants. The tools that are being launched today are the product of much dedicated work and input from many, many people. Many of the people who are here today joining in this webinar actually built these tools. Nearly 800 people around the world have provided input. So it's really a session today to share and celebrate the work that we've done together. The world has really gotten small. It's very heartwarming to see the names and messages come in the chat from people around the world who we've talked to develop the tools in each country. We can go to the next slide. The shared motivation for these tools is the understanding that diet is very important to public health and public health nutrition. It's consistently ranked at the top of risk factors in the global burden of disease. It's estimated that half of the planet suffers from malnutrition in at least one form or more, and poor diets are estimated to cost about $3.5 trillion per year globally. So diet has a huge impact on well-being, yet we do not currently have a robust monitoring system for tracking it. And this is unlike any other major public health challenge where we have tracking systems. So the Global Diet Quality Project, which is a collaboration between Gallup, Harvard Gain, and in collaboration with many other partners as well, we aim to provide the tools and data for tracking diet quality across countries. Next slide. The challenge that we started with is the need and desire for routinely collected, globally implemented, internationally comparable, and robust diet quality data. Next slide. The effort towards that aim started about 5 years ago with a technical advisory group meeting convened in 2016 by Gallup and with the support initially of SDC, the Swiss Agency for Development and Cooperation. And in this meeting, many experts came together, some of whom are speakers or panelists today, on thinking through what are the essential components we need to cover to monitor diet quality. And the two key components were nutrient adequacy and risk factors for diet-related non-communicable diseases. Also, there is interest in being able to track as well ultra-processed food intake and nutrition transition, because these are related to both nutrient adequacy and NCD risk, and also environmental sustainability of diet patterns. So we had that as in mind as well. Next slide, thank you. So it was understood that we needed a new tool to be able to accomplish that and some additional indicators. So we did have a starting point of the MDD-W indicator, which was validated to capture nutrient adequacy and requires data on 10 food groups, consumption of 10 food groups at population level. But we all recognize that that wasn't enough. For diet quality, we also needed the second piece of risk factors for diet-related NCDs. So one of the first steps was to develop a new indicator, which is the Global Dietary Recommendation Score and its subcomponents. You can read the details of it in a paper that was published about its validation. It has two main pieces, which are the healthy food groups and the food types to limit, and the combination creates the Global Dietary Recommendation Score, which is correlated with risk factors for NCDs. It reflects the WHO guidance on healthy diets and is also correlated with ultra-processed food intake. So this indicator requires additional food groups beyond the 10 of the MDD-W. And so the tool to measure these indicators was developed in tandem with what we wanted to get out of the tool. So it was fit for purpose. Next slide. Ultimately, we settled on 29 food groups to be included in the diet quality questionnaire. You can see these here. They cover plant foods, animal source foods, and foods to limit. They cover all of the groups needed for MDD-W, but sometimes disaggregated to better understand both health promoting factors for dietary adequacy, and then additional food groups to capture NCD risk as well. Next slide. So we needed food group data on all these food groups. And the next challenge was how to collect valid and consistent food group data. We did cognitive testing in many people, over 100 interviews in 6 different languages, testing different ways of asking questions to people about food group consumption, and then interviewing them about their thought processes as they answered the questions. Our key findings from all of this cognitive testing was perhaps not too surprisingly, people group foods differently. Not everyone thinks of a vegetable as the same thing. Some food groups have no shared understanding. Asking people about whole grain foods does not result in any good information. Fast foods is another category where people have many different concepts of what that term would mean. And so we found that through many of the food groups that we just couldn't ask about food groups. In addition, when asking about other foods that belonged with a group, the ability to come up with other foods that might belong there varied widely. Some respondents could think of lots of foods in that food group, and others didn't really think of any other foods, which may be correlated with educational status. Next slide. So what this looked like was that we asked different versions of the question. And when we asked people about grouping any other types of food, they sometimes included items that didn't belong in terms of what we wanted from the analysis and couldn't always think of other items. But if we asked them just about food items themselves, they responded easily to up to about 7 sentinel food items per question. Next slide. So our next step was to think, what if we simply ask respondents closed-ended questions about sentinel foods for each food group? We were doing some secondary data analysis and found that, for example, in the United States, asking people only about potato would capture 98% of all people who had any white starchy root or tuber. So there was no need to ask about other white roots or tubers, which is not a term that anyone understands anyway. So because we are interested in indicators at population level, and a short list of foods might capture the population level consumption rather than individual level, this is an approach that could work. So we did a validation study of the sentinel food method to identify food group consumption, which was carried out in China, Brazil, Ethiopia, Mexico, and the United States so far. Next slide. This is an illustration of some of the results of the validation of sentinel food selection. This comes from China in work led by colleagues at Peking University. And what we see here is that sentinel foods capture over 95% of the people consuming any item in the food group. And this works nationally, which you can see in the red line, as well as in each province in the vast majority of cases. And in most cases, in most food groups, we needed only about 4 to 7 items to capture over 95% of people consuming the food group. This was slightly higher for the more diverse food groups, including dark green leafy vegetables, other vegetables, and other fruits, where we have 2 questions per each of those food groups. And this is from China, but we found similar results in all the countries where the validation analysis was done. Next slide. We then did a validation of the complete DQQ against a standard method, a 24-hour quantitative multi-pass recall in 3 countries. So we did this field study in Ethiopia, Vietnam, and Solomon Islands, and found that DQQ returns very close results to a quantitative multi-pass recall. On average, there was only about a 3 percentage point difference between the 2 methods in identifying food group consumption, and the difference in diet quality scores between the 2 methods were very small, as you can see in the chart for the 3 countries. Next slide. Then we also were concerned about whether the method would work well when implemented at scale. So we piloted the DQQ in the Gallup World Poll, and found that the entire DQQ took about 4 to 6 minutes to administer. There were no outstanding issues in training or implementation. Training was very simple because the DQQ is written so that it can be read by any enumerator the same way every time. Since we don't ask about other foods, there's no probing, and simply the question items are asked the same way each time. Enumerators reported that the module was not difficult to implement and was well understood. And so this satisfies the goal of minimizing burden for both respondents and enumerators while gathering accurate data. So we have a validated tool, but we need to identify sentinel foods for each country now. And this is where you all came in. So many, many people here contributed to building these tools by identifying what those sentinel foods are in each country. You probably may recognize some of the people pictured here in this slide who are the adaptation team. This team has worked tirelessly to ensure that everyone's voices are heard, incorporate all of the feedback from all key informants into all the tools. So overall, our adaptation team interviewed over 750 key informants in 104 countries to date to identify sentinel foods. We scheduled interviews and asked about commonly consumed foods in each country. We asked about how they're called so that they would be understood when asking the survey questionnaire. And then we looked at the results across countries in the same region, looking for any anomalies, and followed up in order to ensure that the understanding was complete and the DQQ tools were harmonized to make sense in country and across the region. So a huge thank you to this wonderful adaptation team and to all of the key informants who responded. And also thank you to the many organizations listed here in this slide who helped us to identify key informants in each country. It was kind of the perfect pandemic activity. When we could not travel, we traveled virtually by having Zoom calls with people around the world. So thank you. Next slide. What resulted was not only DQQ tools, but really a global ethnography of commonly consumed species and foods around the world, because we understand from all of the key informants, not only which foods are the most common, but also how they're called and understood. So one of the next steps is going to be to put this on the map in collaboration with the Rockefeller Foundation in creating a world food map of all of the DQQ foods that have been identified in each country. Next slide. And you can see here just a couple of excerpts of 2 DQQs to have an illustration of how the country specificity differs. So we keep the same universal food groups everywhere, but in each country, the questions reflect the most common foods. So in looking at each country, if you are from that country or familiar with that country, the food items you see should appear obvious. It should appear like very normal that these are foods that are in the country. And the innovation here has been to pull that information together from everyone who knows it very easily and make it available to everyone. Next slide. So these are the countries where we have to date adapted the DQQ. We've talked to key informants in each of these countries. And of course, the intention is to fill in this map to cover all countries, which we hope to be able to do in future stages. And next slide. Another exciting next step is that there's actually going to be national data that's available, which is currently being collected by the Gallup World Poll in the countries that you see in the dark blue. So nationally representative data from the DQQ will be coming soon, so at some point in 2022. Next slide. So where can you see all of the tools and the information about the project? You can go to dietquality.org, which is our website, and find all of these tools. Next slide. I think there's a previous slide, and you'll see on the homepage that there are 3 sections. There's a section about the project. There's this section here that you can see the DQQ tools and data. There are the downloadable country adapted DQQs available for everyone. Just a side note, I was alerted that there may be technical issues with some of the links. So not to worry, in case your country is not listed immediately, it will be corrected by the end of the week, but most of them should be visible there already. And there's also a guide on how to use the DQQ. So these are training slides, just explaining in brief how the DQQ is administered. It's, again, very simple that the questions are just read aloud in the same way each time. It's also important to emphasize that the DQQs should not be changed. They are already completely and fully adapted for each country in this exhaustive and comparable process across countries. So what you'll notice is that each DQQ does not have all the foods that are eaten in a country, and that's intentional. Many food items are excluded, either because they're usually consumed in small quantities or they're simply not sentinel foods. They're not needed to capture the majority of consumption. So in implementing these tools, for the purpose of rigor, validity, and comparability, they are to be used exactly as written, which really eliminates the burden of any further adaptation or implementation challenges. Next slide. Then you can also see in the Diet Quality Indicators tab an indicator guide for how to calculate the MDD-W, the GDR score, and other indicators of diet quality from the DQQ data. In the future, we will have an app to help people do this even more easily, supported by USAID. Currently, it is just a PDF guide, but the indicators are very easy to calculate, working from the framework of the MDD-W, which is simply food group consumption and calculated into an overall score. So you can find that there, and in the you can also find the diet quality country profile for one country, Ghana, as an initial taste of what's to come, where the data have been collected this year in a nationally representative sample in Ghana from July through September. And we now have a country profile showing diet quality indicators and information. Next slide. So this is an example of how quickly the data can become available and be useful for policy discussions, and hopefully that cross-sector conversation that Mr. Mitzi was mentioning earlier in his remarks. Next slide. So a huge thank you to my entire team of collaborators, the Global Diet Quality Project core team, including Andy Zeppa at Gallup, who you'll hear next, Lynette Neufeld and Ty Beal at GAIN, and the adaptation team, Cecilia Gonzalez, Christina Sukarenko, Andrea Spray-Balungu, Betul Uyar, and Chris Vogliano. And research collaborators, there are many, some very key people in the beginning were Terry Ballard and Doris Wiesman, many excellent collaborators at Wageningen University and the University of Sao Paulo, and many others as well, including you all. So thanks once again, and you can see more collaborators at the website. Next slide. And lastly, a huge thank you to our donors listed here. We certainly couldn't remotely come close to realizing this vision without your support. So huge thanks, and I will end here and pass it back to Diana.
Thank you, Anna, for that thorough overview. There have been requests in the chat to share this presentation, so you're in demand. We now move to two colleagues who will discuss the implementation of global multi-topic surveys. I'd like to introduce first Andrew Zeppa from Gallup Inc. Please, Andrew, over to you.
First of all, I'd like to echo Anna's sentiments and just say thank you to everyone who's helped make this project a reality. Obviously, it's been a huge labor of love over the past 5 years, and so it's hugely heartwarming to see it come to such a head now at this point in time. Gallup's founder, George Gallup, once said there's 5 billion ways to lead a life. We should study every single one. And so obviously there's a few more than 5 billion people in the world, but that sentiment still remains largely true. And that's if we're going to really understand the well-being of the world, We need to speak to the world. And so 15 years ago, Gallup started on a journey to do exactly that. And so since 2006, we've been undertaking nationally representative surveys, approximately about 142 countries every single year, representing about 98% of the world's adult population. In approximately 110 low and middle income countries, Gallup trained local partners are undertaking face-to-face interviews in over 100 languages and dialects to address some of the world's biggest, hairiest, most audacious global data gaps. As Anna identified, understanding the rise of the dual burden of malnutrition and the increase in dietary-related non-communicable diseases, alongside addressing the climate crisis, is perhaps one of the biggest challenges facing the world today, where perhaps we have the least data. So despite the very, very high human and financial costs of poor diets and its contribution towards the climate crisis, we still don't actually know what the world's eating. So there's a vast graveyard of discarded and unwanted metrics, some nutrition metrics of various quality and validity. Despite some of the validity of these instruments, many have been left to rust in neglect because they're either unwieldy or impractical to scale up, which and therefore enable widespread use. The beauty of the DQQ is that it's been designed to support national, regional, and global monitoring. That's been very much one of the guiding thoughts in its design. It's short. It takes approximately 5 minutes to implement, meaning it's not taking up a huge amount of survey real estate when you're looking at a multi-vehicle survey instrument. It's easy to implement by people with non-nutritional expert backgrounds. You don't need a PhD in nutrition to implement the DQQ because the hard work's been done by those people with its PhDs already. And also, it's very, very easy for the respondents. Essentially, a low cognitive burden upon the respondents, making it easy for them to recall and respond accurately, yielding very, very high quality data. So this makes the DQQ perfect for instruments like DHS, as we'll hear shortly, the Gallup World Poll, and also an array of country-owned national survey vehicles. So for the first time, we're actually in a position where not only do we have platforms for global data collection, but we've also got an instrument which is appropriate for global use. So in the same way that Gallup through the World Poll supports the World Bank with the global measurement of financial inclusion in support of SDG 8.10, the G20's basic set of financial inclusion indicators, support some of the Rome-based agencies and FAO with supporting on SDG 2.1.2 and food insecurity. We're now in a position to not only see, can people fill their bowls, but even more importantly, what's in the bowl? So Gallup's role is very much a catalyst to support the adoption of these tools, essentially using our global infrastructure to act as a primer, get the community familiar with using this data, with using this instrument, creating an initial global baseline so that we can actually track progress in the future once we, as countries do start to adopt and take on board these instruments and these metrics. And essentially using that infrastructure we've developed to have translated and adapted questionnaires in over 140 languages and dialects eventually, which will be available on globaldietquality.org, thereby trying to remove some of those key barriers for adoption of this instrument. As Anna mentioned, 42 nationally representative country surveys have now been complete, and the data which will be available publicly on the website next year. Essentially, we're looking to create a monitoring system to add accountability, provide governments and civil society a vital indicator of both the current and also predictive of future health of their nations. Ultimately, Gallup's aiming to support the transition to a place where governments themselves are taking ownership of these instruments and the measurement agenda, and thereby putting these metrics in the heart of their own decision-making process, thus enabling them to take greater action to combat malnutrition in all of its forms and curb the spread of non-communicable diseases. Thank you.
Thank you, Andrew, for those comments. I now introduce Rukundo Benedict, who is a nutrition technical specialist from Demographic Health Surveys. Welcome, Rukundo.
Thank you, Diana. It's a pleasure to be here today to share a little bit more about the DHS program's use of the DQQ question adaptations for women and infants and young children. So for those that are not familiar with the DHS program, we are a USAID funded project. And since 1984, the DHS has provided technical assistance to host countries in the collection, analysis, and dissemination of accurate and representative data on population, health, and nutrition. By doing this, the DHS reinforces the institutional capacities within participating countries, develops new procedures and methodologies, and improves access to the data for dissemination and further analysis. And to date, we have assisted more than 300 countries in more than 300 surveys in over 90 countries. So the DHS program has routinely collected information on infant and young child feeding practices for more than 30 years. And these data are used to calculate the global IYCF indicators as per the WHO UNICEF guidelines. For women, starting in DHS 8, which is this current round of the DHS, women's dietary practices information is now a core component of the surveys. And now surveys will routinely collect dietary information from women aged 15 to 49 and report on related global indicators as per FAO guidance. For every DHS survey, several sections of the questionnaire are adapted to reflect the local context, but at the same time maintain cross-country comparability. And as you can imagine, this is a fine balance. And moreover, DHS surveys are large multi-topic surveys. And so this process can be time-consuming. For the dietary practices questions for children and women specifically, we have found that they are among the most challenging nutrition questions to adapt, as foods and liquids are so context-specific. So for us at the DHS program, the DQQ adaptations have been an invaluable resource. The DHS program are extracting information from the country diet quality questionnaires and applying these adapted liquids and foods to the standard dietary questions in the DHS core questionnaire. And to date, the DQQ adaptations for children and women have been incorporated in 14 surveys, and this number will continue to grow as more countries undertake surveys. So we are deeply grateful for the collaboration, commitment, and the leadership of the Global Diet Quality Project. And this has resulted in better country adaptations of dietary questions in DHS surveys. Thank you. Over to you, Diana.
Thank you so much, Rakunda. I'd now like to turn to 3 country case examples in Ghana, Zambia, and Vietnam. First, we have Essie Amuafu, who is the Director of Nutrition from Ghana Health Service in the Ministry of Health of Ghana, who will provide remarks. Thank you, Essie.
Thank you very much, Diana. Hello, everybody. I'm indeed grateful for the opportunity to comment on the Ghana diet quality profile. The current trends in the country shows an increasing burden of undernutrition and overnutrition. And this is very worrisome for obvious reasons. There are a number of in-country actions to reverse this. It is therefore very refreshing to have current data from the Ghana Diet Quality Assessment that has provided insight into dietary patterns, as well as other dietary factors that may put the population at increased risk of various forms of malnutrition. Ghana has been in need for diet data at national scale, considering that the last time we had a national survey was in 1976. And we know diets have changed dramatically since then. So have the determinants. The results of the diet quality assessment, which has been implemented in Ghana at national scale, shows some very interesting information. It gives us the hard data as evidence for discussion with decision and policy makers about how to take action to improve agriculture and food system for improved nutrition outcome. Indeed, over the last year or so, there has been ongoing action to develop national food-based dietary guidelines for the country to contribute to the collective action to improve nutrition and well-being of the population. This effort has, however, been largely hindered by lack of current data on diet patterns in the population. The new data has provided current data to help inform the formulation of food-based dietary guidelines that make sense for today's Ghanaian population. In particular, it will guide where to target messages and behavior change actions. For example, the data shows that most people consume vegetables, but not in high enough quantity, and consumption of fruit is particularly low in rural areas. This, for instance, is important to guide agriculture plans to help make these foods more available and increase utilization. This data can also help with efforts to improve the food environment for nutrition. Again, the DQQs show that sugar-sweetened beverages consumption is very high in Ghana and actually on the increase, especially in urban settings. Not surprising though. While we know this and we've known for some time, the new national data collection of the DQQ gives us the data so that we'll have more leverage in dialogues and engagement so that we can start to track trends over time into the future. As far as the future outlook is concerned, these new data set will contribute a lot into ongoing discourse on the rollout of the Ghana Wellness Program led by the Ghana Health Service that aims to contribute to reduction of mortality, morbidity, and disability associated with increasing trends in overweight and obesity, non-communicable diseases, and other emerging diseases and disorders in Ghana. My expectation is that we can expand the scope of the assessment and further adaptation of the DQQ, focusing on infant and young child feeding to support the current in-country campaign to improve quality of diet for infants with the aim of reducing current levels of stunting and the increasing burden of overnutrition among children. It is our wish that there will be future strengthened partnership with the Global Diet Quality Project to share the findings and the tools with stakeholders in the country and ultimately guide the creation of the enabling environment in regulation, further research to support nutrition programming and track progress. I thank you for your kind attention. Over.
Thank you, Essie. We now go to Zambia, where Musondo Mofu, Deputy Executive Director of the National Food and Nutrition Commission of Zambia, will share experience from there. Musondo, over to you.
Thank you very much, Diana. Zambia, through the National Food and Nutrition Commission, is excited that we are finally releasing these tools for use. This is very important for us in Zambia. You may wish to know that colleagues from the National Food and Nutrition Commission in Zambia took part and supported the adaptation process for the DQQ in Zambia. And this is very important for us because, you know, the tool for Zambia as actually a representation of the key critical foods across the country. And this is important for Zambia. You know, Zambia at a very highest level adopted the MDD-W indicator in 2018 for use at population level. And this was mainly because we needed, you know, an indicator to monitor the quality of the diet, especially for women. And so during a nutrition summit, government at the very highest level adopted the MDD-W. And this was aimed at ensuring that policy actions to support you know, foods of national importance was placed at the highest level. And we saw that this was helping the country because certain foods that were poorly consumed, then, you know, immediately our behavior change communication efforts would focus on that. But one of the critical aspects is that in terms of data collection, the MDD-W actually requires a thorough training. And you need to minimize errors as much as possible to ensure that you have high quality data, which you can actually describe the population properly for the benefit of policy as well as programming. So with the coming in of the DQQ, I think the adaptation process, we have observed that the DQQ actually is much simpler and will help us a lot. And this is because we have included the MDD-W in 2 surveys, the National Food Consumption Survey, as well as the Scaling Up Nutrition First 1,000 Most Critical Days baseline. And we've seen how, how much effort needs to be put in order to ensure that you collect high quality data. It's because you need to select, data collectors of high caliber. You also need to collect data collectors, who really can understand and train them thoroughly. And that is quite involving. So with the DQQ, I think we are hopeful that then it will cut the cost. It will also cut the time that is used in the training as opposed to the MDD-W. And so this really is going to help our country and ensure that we are able to collect high quality data, which can feed into policy. Zambia is one country where when we are adopting the MDD-W, we are targeting undernutrition among women, but eventually now overweight and obesity is steadily increasing. And that quality should help us create a balance and ensure that humans, the population is able to have adequate nutrition. So we are really grateful, Anna and team, for the work well done. This really is going to help us, and next year we should be able to include that in the next survey. And we are really excited that DHS finally would consider this, because we had approached DHS for the DHS 2018 to collect MDD-W data through a much better and quicker method. So the consideration really is going to help Zambia as it were. So thank you very much, and all those that have supported this initiative. This is the discussion we should be having during our lifetime, because we need really to improve, nutrition of women and the population at large. So thank you very much, Anna and the team. Congratulations, and really we congratulate ourselves as well. Thank you very much.
Thank you so much, Ms. Linda, for sharing that experience. We now turn to Vietnam, where Dr. Ha, the head of the Department of Community Nutrition in the National Institute of Nutrition in Vietnam, will join us. Over to you, Dr. Ha.
Thank you, Diana. Hello, everyone. First of all, I would like to say that I'm very happy to join this important launch of DQQ, and I'm highly thankful to the great efforts of the Global Diet Quality Project to develop, validate, and adapt DQQ to such many countries globally. Congratulations. As we all know that diet is a key component of nutrition and an immediate cause of both under and over nutrition, especially diet-related NCDs that are highly prevalent now, yet not much is known about dietary intake across the globe. The most important reasons is we do not have an appropriate tool to collect this data. The food consumption data is often collected by 24-hour dietary recall, which is really time-consuming and costly, that not many countries can afford, especially those in the low and middle income countries. Vietnam is among the few countries who has conducted the national food consumption surveys, but it was carried out every 10 years, which is a long period, while the food consumption pattern has been changing so fast these days. In addition to that, which first have been spent to develop the supportive tools such as the portion size estimation as database for food and recipes, food conversion factors, food composition table, etc., in order to have as precise data as possible, particularly in countries with like food sharing culture like Vietnam. So recently we were lucky to be able to work with the index project led by the Tufts universities to adapt and validate the index 24 platform, which is used mobile web app to collect 24-hour data data. This work helped us to make great progress in dietary assessment, particularly for the National Food Consumption Survey and other studies. However, still a lot of work needs to be done and it requires the very well-trained personnel, equipment, and other resources. Therefore, in between the national surveys, the need to have a simpler and quicker tool in order to capture the key characteristic of the diet quality for the monitoring purpose that can be done on the yearly basis in order to allow us observing the trend of diet quality to see more the differences between the settings such as the urban rural areas, geographical regions, different age groups and gender and so on. So in Vietnam, with the nutrition surveillance system setting in all provinces of the country, and the data collected every year, but mainly focused on anthropometric data and limited IYCF indicators. Then it was a pleasure for Vietnam that the Global Diet Quality Project partnered with our colleges at the Hanoi Medical University to validate the DQQ against quantitative 24-hour reference methods. And the DQQ is shown that as well as compared to the reference method, this is really great news for us. I myself was also involved in the process of adaptation of DQQ for Vietnam. So I do think that it is a suitable tool to apply in the Vietnamese context. With DQQ, which requires only like 5 minutes with very simple yes or no questions on the very short list of the most commonly consumed food items by food groups. That make it really simple to implement for both enumerators and respondents. So I do think that it is highly relevant for the monitoring purpose of diet quality for the countries. With more targeted groups covered, more regular data collection and less resources burdens and quicker results available. Another good thing was that DQQ covers the food groups that represent the issues related to both under and overnutrition or unhealthy food that related to NCDs, which accounted to measure morbidity and mortality burden in Vietnam now, as well as many other countries. So in brief, I think that DQQ is an appropriate quick diet quality assessment tool for monitoring purpose for countries, particularly those in a low middle income country like Vietnam. So such information would be useful for countries and their governments who are the primary users of diet quality monitoring, along with the researchers, program implementers, industry and other sectors outside of nutrition. Countries should welcome such initiative, given that many countries have developed their food-based dietary guidelines, but lack ways to assess how their population are eating following the guidelines and how this is changing over time. So I do hope that we will see DQQ be used in many countries in the near future. And thank you very much for your attention.
Thank you so much, Dr. Ha, Essie, and Musonda for those rich examples. Our last part of the agenda will examine enabling diet data collection at scale and aligning with priorities to promote healthy and sustainable diets. First, we are joined by Roy Steiner, Senior Vice President for the Food Initiative at the Rockefeller Foundation. Please, Roy, the floor is yours.
Thank you, Diana. It's a pleasure to be here and learn about all this amazing work. As many of you know, the Rockefeller Foundation has been investing in food and agriculture for over 108 years. But except for the very early part of that history, where we actually helped establish a number of schools of nutrition, including the one Anna goes to, is part of, we have really focused almost entirely on productivity. And what's clear from a lot of the true cost accounting analysis we've done is that, you know, diet-related disease is the largest externality of our food system. Trillions of dollars are destroyed every year because we're not delivering high-quality diets to our populations. And not being able to measure this is such a huge constraint. So it's so exciting to hear the work that's being done. I want to congratulate all the people who've put so much effort into this. And I do think that this is really going to bring a whole new era of nutrition science and research to the world. So that's extraordinarily exciting. I'm also excited by the fact that there are a number of complementary efforts going on that will really move the whole field of nutrition forward. One of them, for example, is the Periodic Table of Food initiative that will use the latest mass spectrometry to create standardized ways to measure thousands and thousands of compounds within each of the thousands of foods that feed humanity. That will be connected, for example, to the global food map that so that we'll really understand in much more detail all of these foods that people are, the diversity of foods that people around the world are eating. I'm also excited that, you know, we can take some of the work that's been done and use it for example, the Global Meal Quality Score, and enable institutions like the World Food Program and other schools and hospitals, et cetera, to really improve their overall meal menu. So it's a different purpose, but it's, I think, quite aligned. So very exciting. And once again, congratulations on this terrific work.
Thank you so much, Roy. Next, I'd like to introduce my colleague, Nancy Aburto, Deputy Director of the Food and Nutrition Division at the Food and Agriculture Organization of the United Nations. Over to you, Nancy.
Thank you so much, Diana. And first, I'd like to congratulate the government of Japan for the success of the Nutrition4Growth Summit over the last 2 days, and really to thank them also for their vision that provided the opportunity for us to be here today to discuss this topic under the auspices of N4G. So starting, of course, our point of convergence for everybody here today is that healthy diets from sustainable food systems are really the cornerstone for good nutrition for today and for future generations. And as all of you likely know, FAO's mandate includes a special responsibility to support raising levels of nutrition. And data on diets, including dietary intake, food composition, diet quality, et cetera, are really at the core of FAO's work in nutrition. Therefore, we very much welcome the current intensified focus on data at national level, at regional, at global, and also at local levels. But this intensified focus has also really highlighted the gaps in our existing knowledge. And that robust dietary data are absolutely fundamental for us to be understanding those risks for all forms of malnutrition and diet-related NCDs. And this data is also critical for information on the barriers to good nutrition. I think that was brought up by our colleagues from Ghana, as well as informing policy and action to overcome those barriers. And also, as we learn more about food systems from which diets are derived, we can also generate knowledge on the impact that this has on all pillars of sustainability. Yet, as we discussed at the beginning of today's event, we really don't have that systematic information about dietary intake from across the globe just yet, especially in low and middle income countries. So FAO is very happy to be partnering to work to help fill this knowledge gap. We do this through the promotion of and the support to the collection, dissemination, and use of dietary data and linking the healthiness to sustainability. So real quickly, Diana, if I may, I'm going to highlight 3 concrete examples of the work of FAO in this regard. The first is the FAO WHO Global Individual Food Composition Tool, or the GIFT tool, which is a platform that compiles, harmonizes, and freely disseminates detailed dietary intake data from individual quantitative dietary surveys from around the world. There are summary statistics available on dietary and nutrient intakes. And this information is also used to inform food safety exposure risk assessments. There's also downloadable micro data for personalized and innovative analyses. And FAO, we're also working with countries to strengthen their capacities to engage with this platform. So that's in the collection and the management of this complex data and the integration of and use of the data in policymaking processes. However, of course, as we've hit on today, the collection and management of this type of data is relatively costly and complex. Therefore, we're also working to support these complementary forms of data, including the robust diet quality metrics that we're focusing on today. So a second initiative is our longtime support on the use of that minimum dietary diversity indicator for women that we've also talked about. This is that rigorously validated proxy indicator for dietary adequacy for micronutrients. And we've recently published an updated manual on the measurement to facilitate the use and uptake of this indicator from around the world. And as Anna covered in her presentation, the MDD-W really only captures that one critical aspect of diet quality. So we're also working to see how we can support the evolution of MDD-W along with other metrics to provide more holistic information on diet quality without losing that strength of validity. And finally, our third initiative that I want to highlight is relatively new, and it brings in that concept of sustainability, which we haven't really touched on in terms of metrics yet. To achieve that food systems transformation for healthy diets, not just for today, but for the future, we've really got to have better and greater access and use of data on healthy diets in conjunction with sustainability. So back in 2019, with our colleagues at WHO, FAO defined guiding principles on sustainable healthy diets. And since then, FAO has conducted a robust literature review and developed a compendium of indicators that correspond to those guiding principles for sustainable healthy diets. And our aim is ultimately to support the collection of simple metrics that bring together those two concepts, that healthiness of the diet and that sustainability. So in conclusion, translating evidence to action really requires robust data from a range of different sectors and different metrics and indicators. And it's really important that we get timely information out there. But these metrics are just one of a number of tools in our toolbox, and we look forward to working with others to help use these tools so that we can make a real difference for nutrition. Thank you, Diana.
Thank you so much, Nancy. And last, over to Francesco Branca, who's the director of the Department of Nutrition and Food Safety at the World Health Organization. Please, Francesco, the floor is yours.
Thank you very much, Diana, and good morning, good afternoon to all. It is a pleasure to be sitting with you today, or standing, because we really have been showing a lot of interest in having an index of the impact of all interventions to improve the quality of the diet. Also with the idea of having a clear goal, which could then be linked to the Sustainable Development Goals. So this is definitely going in that direction. We also have a WHO internal programmatic goals that would build on an indicator like this. So when we have been asked by the group, by Harvard and Gallup to join the first meeting on the validation, we were very happy to see the direction it was taking. And since then, I think WHO has been contributing also with local adaptation to the development of the questionnaire. As Nancy was saying, we are suffering from the lack of data. And the joint effort to compile a database, a GIFT database, is facing the challenge of having only certain data sets that would describe the situation only in particularly high income and maybe higher middle income countries. So having a simple tool has been on the horizon for many years. Now we have a tool, and we believe that this is a very interesting and very useful tool, very practical. I think that's great. But we also, in addition to the tool, we appreciate the work that has been done on the use of the data. And WHO and UNICEF have set up a technical expert advisory group on nutrition monitoring, which earlier this year convened a meeting. There's a diet quality project that is done jointly with USAID, which reviewed the set of indicators. And clearly, the health diet index and then the GDR score, as had been described by Anna, really show an incredible value in helping define dietary quality, also in terms of the NCD risk. MDD, the minimum dietary diversity for women, is an incredibly powerful tool, and we're very grateful to DHS for basically providing the information to measure it, but it is indeed lacking the understanding of the dietary factors for NCDs. So given the huge burden of the NCDs globally, it is really important to have that understanding. So we believe that having the diet quality questionnaire, in addition to the data that come from the DHS, is a very valuable, basically set of tools. We also appreciate the fact that this particular score is the only one that really uses WHO recommendation as a basis, and I think it's important to have that global harmonization and global understanding, common understanding of what healthy diet means, how we define that, and then clearly how we measure that. We would like to continue this engagement. We would like to engage in the follow-up towards potentially the adoption of this as a global tool. Perhaps this is most of the work, but there are some additional elements to be considered. And one of them is the fact that guidelines are updated, and WHO guidelines are being updated. For example, we're about to publish early next year, fiber and whole grains guidelines. We know that this indicator has challenges. We have, there's still the challenge of understanding salt, for example, or even understanding how we weigh the dietary recommendations. So there's some work to do, as well as the work on sustainability, which we would be very happy to continue with FAO. And finally, we also have a tool, a survey tool, which is a step surveys used in the NCD environment. And I think having a questionnaire like this would be a very valuable addition to that tool as well. So thank you, and looking forward to working with all of you.
Thank you so much, Francesco, for those comments. And with that, we will now turn to our question and answer session. The panel has really taken us through some relevant and salient points around the globe. And we have about 10 minutes left for some questions. And please note that those that cannot be answered in this short time could be added to the FAQ, the frequently asked questions of the website. So look for your question and answer there. So the first question coming in from the chat, and I believe this is directed to you. What is the implication of asking only about yesterday? How can this capture normal or typical diets? Are the sentinel foods expected to be consumed daily? Over to you, Anna.
Thanks for that question. Because we are using this tool and indicators for population level analysis of dietary patterns, we can use the method of asking about the previous 24 hours to identify valid population level diet patterns. So this would not be useful as a clinical tool for individuals as much, where different methods are needed to capture usual consumption of an individual. But at a population level, we can use the previous day to understand the complete population, which is how the MDD-W was designed, and now these additional indicators to complement the MDD-W, all of which can come from the DQQ data. Over.
Thank you, Anna. Moving on to another question that's populating the chat. Do you have a plan for periodic updating of the sentinel foods? Or do you think that Sentinel items change so slowly that updates won't be needed for a long time? I believe this is still to you, Anna. Yeah.
Yes, thank you. This is also a great question, which often comes up. So it's forward thinking to ask this question. It is possible in the future we may need to revisit the Sentinel food list, but we expect them to be valid for quite a number of years. And part of that expectation is based on understanding the way that countries usually collect household consumption data and food price data, where the food lists that are used for monitoring are updated quite infrequently, every 5 or 10 years, to reflect how diet patterns and food availability are shifting. So we may want to look at that in the future, but for the time being, we do not expect there to be rapid shifts in the Sentinel foods that would capture food groups. Over.
Thanks, Anna. Also, concern was expressed about the underutilized indigenous foods. So does the tool consider these foods? And there was a note that the person asking appreciates that the fast ability of these, but is nervous about the connotation that's left in people's minds. Indigenous foods are already underutilized. So will this push them further out of our minds and food system?
Thanks, I really appreciate that question, since my own background is ethnobotany and appreciation for indigenous foods and underutilized foods. And really, ethnobotanical methods are what contributed to the participatory approach of determining the food items to include in each country. It's the underutilized indigenous foods are not typically Sentinel food items because such small proportions of the population consumes them. That is why they're underutilized, understood as underutilized. But I'm really excited about the next phase of the World Food Map, where we're partnering with the Periodic Table of Food Initiative at Rockefeller Foundation, where some food composition, chemical composition data on underutilized foods will be added, not as Sentinel foods, not to the DQQ, but alongside the DQQ, so that other foods that may be consumed in the country are recognized, even if they are not Sentinel foods for that country. So more to come. Thank you.
Thanks so much, Anna. There was also a question that I believe Andy can come in on, and maybe also Anna. Is anyone or everyone doing the survey electronically? And are the results going to a central repository?
As Gallup, we're not doing them electronically. So as mentioned, in all low middle income countries, we're implementing these surveys using face-to-face interviewing. In the limited cohort of high income countries we're yet to explore, we'll be using outbound telephone. So nothing digitally, but in response to where this data is available, look on the website and it'll all be there next year. So thank you.
Thanks, Andy. I think this is for the panel in general. Could you say more about how the methods to develop the DQQs are comparable across countries in terms of the number and type, for instance, position in society, food system, or government, of the key informants? Anna, do you want to start that one? And maybe you can loop in relevant colleagues.
Sure, I can start here. So just want to mention that the methods document for how we identified key informants and did the interviews is available on the website under in the DQQ Tools and Data tab. So you can read how we conducted the interviews. If you were a key informant, you know already because you participated. I'm not sure if other colleagues on the panel would like to comment. Perhaps any of the panelists from government offices who participated may have further information.
Anyone else to weigh in on that one?
Diana, I can say a word if I may.
Please, Nancy, over to you.
So we were very happy to be supporting the adaptation of the DQQ to local context in a number of countries. And as FAO, we were hopefully successful in linking with colleagues that had a rural and agriculture connection to the work that they did to hopefully bring in some of that information about those local products, as well as what was just mentioned, some of those underutilized or less well-known foods, which in some cases actually aren't underutilized in a particular context. It's just perhaps at the global level, it's considered underutilized because it's not as well known. So anyways, I just wanted to say that we were, as part of this process, also looking to bring in a different angle to try to help make a very robust set of informants part of the process. Thank you.
Thanks, Nancy. I'll go ahead and move to the next question there. As panelists, if you have further comment, please put in the chat if you can. Will the DQQ indication guide and website also include the indicators in the updated 2021 UNICEF WHO IYCF guide?
Thanks for that question. We have adapted the tools for infant and young child feeding questions and indicators as well. Those are not yet on the website. They are still to come, but it's an opportunity to say that thanks to the support of USAID, we did actually add those as a complement. So we have the adult questions for the general population in the DQQ, and we have the same food items plus additional items important for babies and young children in the IYCF adapted tools, and those will align with the WHO and UNICEF IYCF indicators as well. So it is streamlining the methodology for the adults and IYCF in a harmonized way. Thank you.
Thanks, Anna. And I think we have time for maybe about 2 more questions. So moving on to one about the diet quality questionnaire. While the DQQ gets at diet quality via food groups, is there thoughts about also adding or having a section that will be able to get at the number of meals consumed per day and snacks? Or how can it relate to that?
I could take this one as well as an opportunity to say that the DQQ does not collect that type of information, but there may be many users who would want other information about food consumption or diets than what is captured in the DQQ. And so it's important to say that if you want to collect additional information, such as number of meals consumed per day or amount of foods consumed per day, or any other types of information, that those are treated as separate questions that you yourself can add, to your own survey, like any other survey topic, and collect the DQQ as is, and then have your additional topics and questions that you could look at as other survey topics to provide the type of information you specifically are looking for. Thanks.
Thanks, Anna. And I think we just have time for one last question. As more countries move to mandatory FF of staple foods, would DQQ and other dietary diversity indicators perhaps underestimate the micronutrient adequacy of diets? Perhaps that's a contextual factor to include in country profiles.
I think this question is about food fortification, and the DQQ does not capture fortified foods. We follow the methodology used in the MDD-W in that regard, which looks at the micronutrient adequacy proxied from whole foods. And what it does is give an indication of where interventions are needed. So where micronutrient adequacy is low, there could be interventions and many types of interventions to improve micronutrient adequacy, one of which could be food fortification alongside dietary diversification, agriculture interventions, and many others. So fortification is something that would come after the basic data of the DQQ, not within it. And I don't know if Nancy may have more to say on that aspect.
Actually, from my perspective, I think you've captured it, Anna. Thank you.
Well, thank you to all participants, and particularly to our panelists for your time, your enthusiasm, your passion around this really important topic. We look forward to moving this important discussion forward, and please do check the website where we can follow up with any unanswered questions. Thank you to all. Have a good evening, morning, afternoon, wherever you are.
Thank you. Bye. Bye. Thank you.